We are not nearly at treating 30 patients per day. Right, someone is collapsing as we speak. Let me go to there. He is vomiting, he has diarrhea. Let me just pause the game real quick. He is dehydrated. Hey guys, welcome to Unmodded Gaming. I'm the Unmodded Gamer and I'm back with Project Hospital. And in the last episode you may have seen how I got the intensive care unit, which means that we can get ambulances in, because that is the reward we get for getting the intensive care unit. But for now, I'm going to try and get 5 patients per day treated at any specialized department, because that will give me a $5,000 government grant. Also try to save a patient after one collapses, which shouldn't be too hard. And I'm going to work to try and treat 30 patients per day. And we are already at 26, so that shouldn't be too difficult either. Now that I think of that, it is already 5 minutes to 5 in the afternoon, 16:55, 4:55 p.m. But we still have Mary Williams, who doesn't have a clear diagnosis yet. And we are open from 8 till 6 p.m. So 8 a.m. till 6 p.m. So we gotta hurry trying to find what she is suffering from. We are now taking a blood test. And let's see what else we can do here. So that's quite a lot. Well, I'll just see what their blood test gives us, and hopefully we can get our treatment before the clinic closes. But right now there isn't really much for us to do other than to maybe take a look at some of the patients that are here and trying to see if there are any that don't have a diagnosis yet, like Mary Williams. And we have someone who looks like she could be fainting at any moment. She needs some medicine, some hydroxyurea, a special medication that suppresses production of blood cells in bone marrow, because she is suffering from essential thrombocythemia. Essential thrombocythemia refers to an uncommon condition when the patient's body produces much more platelets than necessary. So she has some symptoms like nosebleeds, chest pain, dizziness, and blurred vision. And of course, thrombocythemia, complete blood count reveals an abnormally high amount of thrombolytis. And wait, where did you go? Oh, she is talking to the doctor now. She is getting some analgesics for chest pain. And I don't want to... Oh wait, I do have to do this. So she could also be suffering from headache, numbness, redness, and slurred speech. Well, that isn't really something to worry about right now, and as you can see, she has already gotten her hydroxyurea or something, and the clinic opening hours have ended. We only had 2 patients waiting, which is unfortunate. If we could have helped them, we could have made it, because we treated 28 patients today. Right, so the night's pretty boring, considering that we are closed for the night. I don't think we have any patients hospitalized yet. I can have a look at it, but apart from that I'll just skip through the night. No, we don't have anyone at internal medicine, and we don't have anyone at orthopedic either, so I'll just skip through the night again then. Which goes rather slowly before 2 or 8 PM. But once the night shift has started, we can press this button here, skip nights, and straight until morning. And of course I can cancel it if I want to. But for now I can just use it to skip through the night. And we'll see what happens tomorrow. Right. We are back in the day. Although it looks like there's some blood here. Well, it will get cleaned up soon enough. And now we're just waiting for the day shift to arrive. You can see them coming here. And it looks like there's also, or there could be, potentially a patient in here. Also the fact that everyone who goes to this hospital or away from the hospital walks over the zebra crossing is, yeah, not realistic at all. Most people would just take the shortest way, or there would be traffic signals, stopping signals. There aren't any here. But good going, game. Good going. Right, so the patients can't come just yet. Because we aren't open yet. We only open at 8 in the morning. This is going to be troublesome, by the way, in the later part of this game, when I have more departments opened. I think that once I have maybe some ambulances, I'm going to start working on the general surgery department, which is on the same floor as the intensive care. Here you can see the general surgery, and here's intensive care, so that is on the same floor. And here are all the operating rooms. So if we go into orthopedy, for example, here we have the operating room, the surgery room for orthopedy, but I already showed you that. That is old news. We do, however, get our first patients in a few moments. Here we go. Patient's breakfast, clinic open. But of course there aren't any patients hospitalized yet. So patient's breakfast, yeah, I don't think my staff has got much to do. Also, we have a few people here who are late. Someone from the intensive care and someone from the emergency department. another one from the emergency. He is also late. And there we have our first patient, who is going to the internal medicine department. Well, let me see what she is suffering from. Thoracic aortic aneurysm or croup. I don't know what any of those are, but it sounds pretty serious. Especially that first one, thoracic aortic aneurysm. That is cardiology. I thought so. It refers to a condition where the part of the aorta in the chest cavity is dilated. The aneurysm can rupture and lead to immediate death. And by the way, the aortic is the biggest, most important blood vessel in your body. So, if that ruptures, that wouldn't be good indeed. But hang on, let me just see, what is croup? Croup is also known as Okay, I wasn't prepared for such a long word. Let me try again. Laryngotract bronchitis. And is usually caused by a virus, rarely by a bacterial infection. So that looks like it is much less of a threat for your life, but it is kind of strange to see that it is either something that is life-threatening or just a simple infection. Well, relatively simple. I mean, sure, infections can be pretty serious, but compared to bleeding to death, not so much. But anyway, since we don't have much to do, there still hasn't collapsed any patients. We are not nearly at treating 30 patients per day. Right, someone is collapsing as we speak. Let me go to there. He is vomiting, he has diarrhea. Let me just pause the game real quick. He is dehydrated, so he needs to get rehydration. He has abdominal cramps, so obviously we don't know what he is suffering from yet, so I'll take over this patient manually and I'll see what they're going to do apart from TC hospitalization at the trauma center, or hospitalization at the trauma center. The trauma center accepts critically ill patients when they arrive at the hospital. So that is all this here. So we got that. And we will be taking there. I hope it doesn't take too long before he gets rehydrated. And then we're going to find out what he is suffering from. Mary Williams. Why isn't she in the thingy here below? So she got her blood test, but we still don't know what she is suffering from. So what we will do is maybe a differential diagnosis. So that is a special case review that reduces the amount of possible diagnoses can only be performed by a doctor with advanced diagnostic specialization. And I have an objective: save one patient after one collapses. So what I'll do to him is a physical examination to begin with. Microbial sampling, collection of samples from the patient, for example, body fluids, sputum, stool, things like that. Okay, that is for Thomas Hernandez. Now my other patient that I have under my control. She can only have either of four things: bronchopneumonia, and that is a type of pneumonia mainly affecting the bronchi. Sinusitis refers to inflammation of one or more sinuses, causes swelling and can compromise drainage of mucus or pus from the involved sinus cavity. Simple chronic bronchitis. A chronic bronchitis refers to a productive, long-lasting cough along with constant irritation of the bronchi lining. Or histoplasmosis. Histoplasmosis, also called cave disease, is a respiratory disease caused by the fungus Histoplasma capsulitatum that mainly affects the lungs. Symptoms vary greatly. Past infection creates partial immunity. Okay, so what I'll do for her is also some microbial sampling, because it seems unlikely to me that it is simple chronic bronchitis. I think we would have seen that on an X-ray, and as you can see here, we have already made an X-ray of her, so it just seems unlikely that she would be suffering from that. Right, another procedure has finished for Thomas Hernandez, and they have found out that he is suffering from salmonellas. Salmonella infection is one of the common bacterial infections that affects the human intestinal tract. Humans become infected by ingesting contaminated water or food. Okay, well, let's do this. And let's just send him to internal medicine, where I will let him be taken care of by the doctors, because his treatment is pretty easy at this point, and I don't need to worry about that anymore. What I am curious about is how far this is going, because I'm going to end the video after she has gotten her treatment. So let's hope this will reveal something, and if it doesn't, I'm going to end the video anyway, because it's getting pretty long. Right, so it looks like she's going to the lab to get her treatment, and I don't want to put the game on to a faster game mode, because I'm worried that someone might collapse and that we may not be in time to save that patient. Also, what I need to do now is I need to reach 80% prestige at the end of the day at emergency, and that will give me another $5,000 grant. is this? I've never seen this before. She doesn't have a doctor, but then she had a doctor? I don't get it. Wait, what? Barbara Anderson is now her doctor, it looks like. We have another complicated diagnosis. Okay. Well, you can say that it is either chronic fatigue syndrome. Chronic fatigue syndrome is a very complicated disease that refers to a condition of fatigue that cannot be explained by any underlying medical condition, or infectious mononucleosis, and it is usually caused by EBV Epstein-Barr virus. People usually get infected in their childhood. There is no vaccine for the disease. In the 1920s it was described as the kissing disease. Right, so I'll just get an evaluation, oral cavity inspection and some serologic sampling, and we'll see how he is doing after that. But for now, let's return to Mary Williams, who is still waiting for the test results of the microbial cultivation. And as I can see here, and it may be difficult to see, but I believe this is her, so that is probably her test being run or something like that. But we have another complicated diagnosis. Barbara Cole. Right, so I'll take her over and let's do some stool collecting for her first, because she can be having amoebiasis, which is caused by Entaboma histolytica. The infection spreads through water or food contaminated by feces. Giardiasis. Giardia infection is one of the most common waterborne intestinal infections. Giardiasis can be transmitted through direct contact with infected individuals or by ingesting contaminated food. Then we have irritable bowel syndrome, which is chronic gastrointestinal disorder demanding a long-term treatment approach. It is not contagious. Diet modifications and medicine can usually relieve symptoms. And then we have Crohn's disease. Crohn's disease is an inflammatory bowel disease that affects the entire intestine. The exact cause is unknown, however, it is evident that there are genetic, environmental and autoimmune components. Well, let's see what the test results say after the stool collecting. I'll return to Mary Williams again, and this is just taking too long. You know what? This was the Unmodded Gamer. Thanks for watching, and stay unmodded.